I cared for somebody for nearly 30 years, my wife, who was suffering from mental health.
I started suffering at 9, couldn't explain it to anybody, and therefore you drop down until you reach rock bottom.
When people ask you how you feel and you don't know,
it came to me as quite a shock, and it was an instant thing, my depression. And all I can say is I felt like somebody had come in and snatched my soul.
Yeah.
That's how I felt. Yeah. I started losing my confidence, and I didn't know why. I didn't know why it was happening. And then all of a sudden, I actually realised I'd gone through an early menopause, but I didn't know.
I do fully understand what it's like to be depressed and anxious, and I've lived with it. I've helped her cope with it as best I could, but that's basically self-taught coper and carer.
I'm fine, everything's great, and you plaster that great big smile on your face and you walk out the door, when inside you're feeling awful, and actually the best thing that you could do is talk to that person and say, I need help, I'm not coping.
I've had mental health, I've had depression, and I thought, before that I just thought I'd gone through a menopause and it was just that. And my brain wouldn't even let me even acknowledge that I'd had some kind of depression or anxiety.
It's okay to feel like how you feel, and it's possible to recover.
Did they ever ask how you were?
No, nobody ever asked how I was really. I think one person twigged it, but most people wouldn't have even thought about my side.
And I've found that talking about it now has been quite easy, and people's reactions have been really kind.
I had to keep myself really normal, if you like, and not appear to be anything else, even though I was going through hell underneath, because I was going home to this every night.
People be scared to ask.
Yeah, I think that's another thing about, I mean, obviously with mental health, it's one of those things people don't like to talk about.
Like from my point of view, I got ME and I was in bed for 3 years, so that my mental health started because of an illness.
With what happened to me, going through an early menopause and not being able to have children, so I feel really strange about about people's reactions to me not having children, because I'll never be able to have children. So I think any kind of awareness is good.
I'm not the only one that self-harms. I'm not the only one that's got a drink addiction, and I'm not the only one that's dabbled in drugs. I'm not the only one with a difficult upbringing, and I'm not the only one with little or no family. I felt on my own all my life. I felt like an outsider all my life, and I felt like I've just been kind of some oppressed, bullied individual. If it is something that you're experiencing, voice it.
And that's the main thing, is to, if anybody's got a question they want to ask about anything that I've been through, I'm willing to be really open about it now.
People need to be able to feel safe enough to open their mouths and say, I'm not feeling too well.